today we have with us Erin Glenn, who's the Senior Director of Nursing at Carilion Rockbridge Community Hospital. And then we have a couple more speakers coming in on March 18th and April 1st. So little plug there, stay tuned for those. Quick overview on how it's going to go down today. I'm going to do a quick little information session on addiction and opioids, and then we're going to have a discussion session with Mr. Glenn, who will answer some questions, and then we'll open up the floor to you, the community, and get answers to the questions that you guys really want to hear about. So as Brianne said, this whole session will be recorded, so you can check it out on the YouTube page. A few housekeeping things. Try to stay muted during the conversation so that we can cut out background noise. And if you have questions, please feel free to put them in the chat, which will be monitored by Brianne and Lena, I believe. So we'll get to those questions. We'll save them for the discussion session towards the end. And like Brianne said, you're free to turn on your cameras if you'd like. Love to see your face. If not, completely up to you. So thank you guys so much for being here with us today. I'm really excited to talk to you guys about this because I do believe it's a really important topic. So I guess we'll get started. So first of all, just wanted to start off, what is the opioid crisis? It's a term that's kind of thrown around a lot, and how it started is really important into understanding how it fully affects us here today. So the opioid crisis is a fairly recent phenomenon. Initially, opioids were only prescribed for short-term use, like after surgery, immediate pain relief there, or for terminal pain for things like cancer. In the 1980s to 1990s, there was a dramatic increase in the prescription rate of opioids for painkillers as in non-cancer related pain. In 1999, 86% of patients who were using opioids were using it for non-cancer related pain, which is a significant number. Doctors were told that there was a very low risk of patients becoming addicted to opioid medications. However, that is not true. And immediately after this increase in prescriptions, we saw an increase in addiction and death rates for opioid overdoses as well. In 2019, there were almost 50,000 deaths due to opioid overdoses in the United States alone, and the numbers have been rising every year. And especially being in the midst of a pandemic, people don't have access to prevention or treatment measures as much, leading and adding to those death numbers. So who does the opioid crisis affect? One of the things that makes the opioid crisis so dangerous and widespread is that it affects everyone. So since the crisis started from prescription medications, opioids have reached all races, all ages, genders, and socioeconomic classes. The former director of National Drug Control Policy for the Obama administration, Michael Botticelli, has said that 1 in every 4 Americans know someone who has died from the opioid crisis, and that 1 in every 2 Americans know someone who has been affected by the opioid crisis in some way. And this just shows how widespread and impactful the opioid crisis is for everybody in America. And this graph here, you can see that the mortality rate for prescription opioids has leveled off slightly, but there has been a dramatic increase in heroin and fentanyl deaths. And we're going to talk about that more in our third community session on April 1st. So again, stay tuned for that if you're interested in learning about that phenomenon and how that ties into the opioid crisis. So when a doctor prescribes opioids for pain management, there is a strong possibility of those medications being misused. Roughly 21 to 29% of people using prescription opioids for chronic pain management misuse them, which leads to a 12% of people developing an addiction, which is fairly significant. Another way that the opioid crisis becomes so widespread is because many people will hang on to their medication when they don't need it any longer, just in case something pops up later on down the road. I know that my family and I are guilty of this even, where we'll just hang on to medications in case the knee starts to hurt later on down the road. But this actually increases the chances of friends, kids, and family members having access to these medications and becoming addicted. So I've thrown around the word addiction a lot, but what is it? And I think it's important to understand this going forward. So basically, addiction is physical and or psychological dependence caused by the long-term use of a substance. For an official diagnosis, there are 9 different pieces of criteria that fall under these 4 categories. So, number one, impaired control. So, this is using more of a substance or using it more often than you intended to, or wanting to cut down or stop using, but not being able to do so. Social problems include things like neglecting responsibilities or relationships, or giving up activities that someone used to care about because of this substance use. Um, there's also an inability to complete tasks either at home, at school, or at work. Risky use includes things like using the substance in risky settings or continued use despite knowing that there's a problem there. Physical dependence is needing more of the substance to get that same effect. And this is something called tolerance. And I'm going to touch on this later on in the presentation. Um, and as well as having withdrawal symptoms when a substance isn't used anymore. And there are relative levels of the severity of addiction. So if you fulfill like 2 to 3 of the things that I just talked about, that's considered a mild addiction. Fulfilling 4 to 5 of these is considered a moderate addiction. And if you hit 6 or more of these categories, then that's considered a severe addiction. And then one other thing I wanted to touch on about this is that there's a lot of stigma surrounding addiction in our society that's misplaced because of the behavioral symptoms surrounding addiction, like erratic behavior or consequences with the law. A lot of times, addiction becomes associated with shame, and this sets up barriers that makes it a lot harder for individuals to seek out help or want to seek out help. And this just makes the problem worse. Addiction is a health problem. It's a disease that changes the makeup of your brain. And it's important to place the blame or to not place the blame on those who are suffering from it. Um, then, one other aspect is risk factors. Some people are more likely to become addicted than others. And these are some of the factors that can influence your likelihood of addiction. I do want to make it clear that being exposed to these do not necessarily mean that you will become addicted, but they do increase your risk. And some of these factors include the environment that you're in, so like who you're hanging around, who you're with, um, comorbidity or having more than one mental illness at the same time, and the accessibility of drugs or how easy it is to get access to them. And this touches back on our earlier point about how important it is not to hang on to your old medication because this does increase the risk of your loved ones having access to the drug. So now let's talk about what we're all here for, opioids. Um, Specifically, what makes them so addictive and why is it addictive enough to cause a public health crisis? So first, I think it's important to understand the ways in which opioids affect your body and your brain. Um, Opioids interact with our reward system, and you can see that here in the image. That's the reward system. That's what we're talking about here. Um, and the reward system drives us to repeat certain actions in order to survive. So it's very similar to eating. So think about sitting down for your favorite meal or eating a big chocolate chip cookie. Um, your body releases a chemical called dopamine, which gives you this calm, pleasant feeling. And dopamine is the molecule that you can see on the screen right now. Um, and it makes you want to eat again. And so for processes like eating, this is a good reaction because you need to eat to survive. However, the same thing happens when opioids enter your system. You can see this in the image here. Um, a huge amount of dopamine, more than what you eat, is released into your body, and your body begins to think that it needs that amount of dopamine to survive. Once that pleasant feeling from the opioids wears off, you begin to experience withdrawal symptoms because your body needs that same level, if not more, of dopamine just to not be in pain. And withdrawal symptoms can start 12 hours after taking the opioids and can last up for 2 weeks. You can see here on the left side, there's an image with some of the potential opioid withdrawal symptoms. Withdrawal symptoms are basically severe side effects of your body getting used to not relying on drugs. Sometimes they're even bad enough to be hospitalized. They can include things like anxiety, body aches, sweating, vomiting, and sometimes even seizures and hallucinations. So these are very severe symptoms to be taken seriously. Um, And then another one of the aspects of opioids that leads to so many overdoses is something called tolerance. And tolerance is basically when your body gets used to the amount of drug that you're taking. So the next time you use it, you need more of the drug to feel that same effect. Opioid users build up tolerance extremely quickly, and they have to take more and more of the drug in order to hold off those withdrawal symptoms that we were just talking about. And this can lead to more overdoses. And one way to think about this is like an athlete. So I run cross country and track and field, so I'll use that as an example. But when I first start running after a break, that first run is really difficult. You know, you're breathing heavily, your legs hurt, your lungs hurt, you're not doing well. It's hard to get through. But that after I get through that first run and I get to my next run, it's a lot easier. I can breathe better, I can run longer, and I can run faster. And it's a similar effect for opioid use. So once someone uses opioids once, their body adjusts to that level of dopamine, similar to how my body adjusts to running again. Um, so the next time they take the opioids, it takes a lot more of the drugs to feel the same effect. And that's basically what this graph is showing here. This blue line, assuming that's the first time somebody's taken it, and it takes a certain amount of opioids to have a certain amount of pain relief. And after a couple of weeks of using opioids, their tolerance is a lot higher. So it takes a lot more of the opioids to have just that same level of pain relief. So the opioid crisis is really important to be aware of, and it impacts a lot of people, but you can help prevent it from getting worse. And RAPC has a lot of different resources that you can use to help prevent yourself or your loved ones from becoming addicted to opioids. So there are medication permanent lock boxes around Lexington, Rockbridge, and BV area. And everyone here will be receiving an email with a pamphlet that will have all this information. So that will be available to you. So those are the different locations. RAPC also offers one free medication lockbox per family, where you can lock up all your medication into one place. They have drug deactivation pouches where you can put medication into a little pouch along with some water, and it'll deactivate the medicine so you can dispose of it safely. There are smart pill bottles that either have locking caps or little timers on the top, so you know when the last time someone got into the medication was. And then there's also a drug take back day on April 24th that's important to be aware of. And basically, you bring your medications to those locations and they'll dispose of them safely for you. Um, so now I would like to introduce Erin Glenn, the Senior Director of Nursing at Carilion Rockbridge Community Hospital since 2013. Prior to arriving to Carilion, he held clinical leadership and regulatory compliance positions in both nonprofit and for-profit acute care facilities. Before he began his nursing career, Mr. Glenn worked as a counselor for at-risk teens, and he earned a BA in social work and psychology from the University of Maryland, Baltimore County, an AAS in nursing from Colorado Mountain College, an MS in nursing from Excelsior College, and he's a board certified nurse executive and is a member of the American Organization of Nurse Executives. When not at work, Mr. Glenn spends time with his wife and 4 children at their home. Thank you so much for being here, Mr. Glenn. I guess we can get into the questions. I guess, Brian, should I stop sharing my screen? Would that be okay? All right. Hi, thank you so much for being here.
Thank you for
So
having
excited
me.
to have you. All right, I guess we'll start off with, could you talk a little bit about your professional experiences with opioids in healthcare?
So I think that my experiences are not unlike many other individuals, with the exception that my prior career as working as a counselor, I did interface in the 90s and early 2000s with many adults and adolescents who had addiction issues. Um, my primary clinical experiences have been in the emergency departments, where I've witnessed the effects of opioid overdose and overprescription, with unfortunately people overdosing and expiring, or being resuscitated from overdoses, and either seeking help or just wanting to go back and repeat the cycles that they were in. In a leadership position, I have tried to work towards the integration of emergency departments with early identification of individuals who would be um, good candidates for medication assisted therapy treatments. But unfortunately, in our community, we don't have the robust resources that larger areas do have. The good news is at Roanoke Memorial, there has been a program that's been set up where individuals who are seeking Suboxone or medication assisted treatment programs can get tied in through the emergency department with a first dose and then follow-up treatment programs. That's the best news I think that we've seen in years, providing that quick early access to a treatment that will delay many of the withdrawal symptoms that you had reported earlier. Considering the quick time frame of suffering these individuals undergo when they stop taking medications, it's important to give them viable options in providing an array of hope to get past their current circumstances.
Thank you. So we talked a little bit about what addiction looks like. What do you think are some of the most prevalent signs of addiction, and what should people be on the lookout for?
So I think isolation of the individual who is beginning addiction is one of the most important things to look out for. Changes in social behaviors that the person isn't seeming who they used to be. Increased drowsiness decreases levels of hygiene. And then also for intimate partners, decreases in libido can be a sign of addiction with opioids. A lot of people don't think of that aspect of their life being affected by addiction, but for those that are closest to individuals who are suffering from addiction, it can be an earlier sign.
Thank you. That's a good point to bring up. And then, as we mentioned, a large percentage of opioid addictions do stem from prescription painkillers. Do you have any advice for patients who are prescribed painkillers or individuals who have loved ones that are prescribed opioids as painkillers?
So I think what's most important is to follow your physician's recommendations on how to manage your pain. Non-opioid, non-steroidal, anti-inflammatory drugs such as Tylenol, ibuprofen, Aleve are great, safer alternatives to opioids. People do suffer with pain that needs to be managed by opioids, but it's very important to not prophylactically use your opiates. It's that using the opiates before the pain becomes too much sometimes leads you into the cycle of needing to take more and more of the opiate. And most importantly is don't save your drugs or your opioids for later, like you were speaking about, Hannah. Just in case the pain comes back. It's important to only use what's necessary. And then if you do have pain later down the road, it's really important to follow up with your primary care provider or the specialist that had been treating you for pain, because a change in the quality or type of your pain could indicate a change in what your condition is, and we don't want to mask that.
Definitely. Brian, is there a thing in the chat maybe?
So I don't see any questions in the chat yet, but Lena did put all of our social media outlets in there. So if anybody is looking for the coalition and the social media realm of Facebook, Instagram, or even TikTok now, we're on TikTok. We're really stepping up. But those are the tags for each of those. Well, one tag, but.
All right, then we'll continue. Again, if anybody has questions, feel free to put them in the chat at any point. So kind of jumping off that last question, if someone has a loved one who is already struggling with addiction, what do you think would be the best next steps for them to take? What's the best way to connect them with resources that could help?
So I think reaching out to your primary care provider is very important. and I emphasize your primary care provider. Sometimes the providers who have prescribed the opioids are specialists, and they're not as familiar with addiction treatment. So your primary care provider is always the best person to go to be the center of the care that you receive medically. Um, Another great resource is SAMHSA. And I'll put a toll-free number in the chat box for people. And that's a government agency that helps oversee substance abuse and mental health treatment. It can be an anonymous phone call, but they can also tie you into any resources within your communities. And then, as I had mentioned, at Roanoke Memorial, they do have a bridge to MAT treatment where they will help provide first dose for withdrawal treatment with follow-up treatments, I believe, within follow-up appointments within 72 hours, I believe, of initial treatment. And that's the only emergency department that I'm aware of in the region right now that has that instant access. Rockbridge Community Service Boards has been working on that program. I'm not certain that the intake is designed for acute phases of withdrawal. And I also believe that the Rockbridge Area Health Center also has some services. So we have some services available locally, but if you just need to get in front of somebody to get that care, you can go to Roanoke to get that.
Okay. And you had mentioned earlier that a good way to prevent addiction is to get rid of leftover medication, unused medication. We talked about a few potential ways already in the PowerPoint. Is there any other recommendations that you have on that front, or?
The EPA doesn't look highly upon it, but flushing the medications down the toilet, if you're desperate and just need to get them out of your way, we're more than happy to take them in our lobby. You listed that as one of the disposal points. And getting the binding pouches is also a good idea because once they're bound, you can't get back to them. But just making them disappear from your immediate location is the best way to make it happen.
Yeah, thank you. And then I was wondering if you talk a little bit about what addiction looks like in the Rockbridge area specifically, because the information that I've kind of given has been more general. So what are sort of the rates of addiction? How many cases of addiction do you specifically deal with? Just general Rockbridge area.
So Rockbridge region has a very interesting addiction profile that's very different than a lot of the surrounding Appalachian and Southern communities. We do have opioid problems. And in our emergency department, we'll see on average 2 overdoses per month. But surprisingly, the drug of choice in our region is methamphetamine. It's less expensive in our area, and it's more prevalent. It's easier to get your hands on. So we do see opioid overdose, but just not as frequently as we do see methamphetamine issues.
Thank you. And then, like you just said, opioid crisis isn't necessarily the biggest issue in Rockbridge County. So why is the opioid crisis something that we should be concerned about here in Rockbridge?
Well, it's definitely an issue. And the problem is that it destroys families. Families that you wouldn't expect it to cause damage to, it causes damage to. Nobody is free from the effects. As you were saying, 1 in 4 people know someone who has died from the disease, and that happens in our community. So even though it's not our #1 drug issue, it is still a significant issue.
Mm-hmm. Thank you. And then one more question. What are some of the issues surrounding the opioid crisis in healthcare, and what are things that are being done to solve some of those issues?
So as I had mentioned, there are the medication-assisted therapy programs, launching out of emergency departments that has happened in some communities. We just haven't been able to get there here yet. Um, Another piece is the state is part of, or all the prescribers within the state are part of a prescription monitoring program where as part of law to be able to prescribe opioids, uh, the providers need to look into a index of individuals who have received opioids to ensure that prescribing patterns are not indicative of drug-seeking behavior. And that's been a great tool so that individuals can't, what used to be known as doc shop, go from provider to provider, say they hadn't been receiving care, and then get multiple prescriptions. Another big push that Carillion has had is a lot of provider education on how to provide alternatives to opioids. And we've also created policies structured around what criteria need to be met to prescribe patients opioids in the outpatient settings. And that's significantly decreased the providers' number of prescriptions that they put out into the community.
Definitely. Thank you so much. Just one last call. I don't think they see anything in the chat, right? Right. Anybody have anything else?
So I do see something in the chat box that says, are there any trends on the demographics of who is affected the most with opioid use or overdoses in Rockbridge County?
Male, female, socioeconomic, it's crossed all lines. I'm thinking from age, probably with overdoses that show themselves in the emergency department, we'll see anywhere from the ages of 18 to 50 years old. And sometimes the individuals who are over the age of 50 who do overdose, sometimes their admissions are not confused, but confounded by other comorbid conditions that create medical issues that we're focused on fixing while we're resuscitating the opioid issue. So it really, it touches everyone.
Thank you. Anything else? All right. Thank you so much for taking time to come talk to us today. Your perspective has been absolutely invaluable. It's been awesome. Thank you so much. Again, thank you to Brianne and Rev C.
And thank you. And thank everybody for coming here today. I want to thank both Erin and Hannah for opening up this very important topic of conversation. And this is just the beginning. So I just want to remind everybody that we are going to have 2 more sessions. And Hannah, do you have the date of the next session right there on hand?
Yes, March 18th. Same time, 12 p.m.
All right. And it looks like, Erin, did you just put the toll-free number in there for, is that the SAMHSA number? Okay.
Yes.
So I will go ahead and read that off just for the recording perspective. 1-888-662-43.
Oh, I'm sorry. It's not 888.
Oh,
it's 1-800.
1-800.
That's what happens when I try to pay attention to the people talking and type.
So it's 1-800-662-4357. Thank you for that correction. But I appreciate everybody being here today, and please share the word that we're going to be continuing this conversation on.